Hey, this is Dr. Sean again over at Natural Body Works, and today we're going to talk about cupping. So I get a lot of questions about cupping, and I got a lot of people asking about different kinds of cupping, so I'm going to tell you a little bit about what the kind of cupping that I do and some of the things we're looking for. So cupping is an old technique. Usually it was used with fire. It's called fire cupping. I don't do fire cupping. I don't like fire being around people and like rubbing alcohol and hair and things like that. And also, when you put the fire cup on, you can't really change the suction. You can't increase it again. You have to remove it and do it again. So usually what happens is it would take, for example, I'm trying to find a good cup, but this is a typical cup that I would use, but you would use like a tongue or a pair of tweezers or something with a cotton ball or something that's on fire, right? Stick it in a little bit, rub it inside, stick it on the person. That vacuum change of heat and pressure will pull the skin up, and then you can either move it around or you can just leave it there for an amount of time. That's fire cupping. Now you can do another one called hijama, which I've heard of, is wet cupping. I also don't do that one because one, ew, it's gross, and two, the regular cupping pretty much does the same thing, just takes maybe one or two visits more. It's not much, but it's really disgusting. What they do is they take the area, they put a bunch of holes in the skin, put the cup on, and pull blood out, and it'll fill this thing halfway, and then it clots, and that's really kind of disgusting. So, one, I don't like getting rid of that stuff, and two, I just don't like doing that kind of cupping. But I use this kind. This is a vacuum kind of cup. It's a Korean style, or a Korean company makes these actually, and it comes with a little cup with a little stop up here at the top. I don't know if you can see that. There's a little stop there, and there's the inside of the cup, like this. Right. Then we have a little suction machine, little thing. There, you can hear it. Right. If I put it on my arm like this, you can see the flesh come up. Maybe. There we go. Flesh coming up, coming up. Right. 1, 2, 3, 4, something like that. Or 4 pumps. There we go. This may be better like this. Right. And it does. It's uncomfortable at first. We leave those on like this, and it'll cause the skin to become a little bit red inside there. And then we can grade how those look. So there's really 5 or 6 different grades we give, and I'll show you those in just a second. So here we go. There they are, right there. I'll post them up too. They might be backwards. But anyway, you've got those 5. Okay, so we have kind of normal would be a nice pink color, and that pink color, which would be right there, good healthy blood circulation. Those spots usually go away in the day, and those are people who would either they've been through treatment or they're just doing well. Okay, it might be that you didn't do enough suction. Usually I start with 3 or 4 pumps. We can go up to 6 or so, something like that, but boy, that kind of hurts. The second area here, moderate stagnation, really kind of a deeper red. It'll have some little red or darker spots in there, and that shows that the fluid hasn't moved very much and needs to move. And I'll explain a little bit later in another video how the fluids move through the tissues and that kind of thing. Another over here is really severe. This is really dark. I mean, it looks like maroon, blackish purple. Sometimes it'll get even kind of greasy on the outside. That's a great sign. It means, well, great for me because I get to do more treatment on them, but they need more treatment because they're having a lot of stagnation issues. Stuff isn't moving very well, and we got to get it moving well. Now we'll wait 3 or 4 days, and then we'll come back and we'll do the place next to it, not on top of it. Especially if it's this color. If it gets down into here, or maybe it stays like that, as blood gets cycled through in any bruise, it turns kind of a greenish, brownish color. That's bilirubin and biliverdin, the breakdown products of the blood that have been moved through the system. Now, other ones we get here, there's congestions and toxins. We'll see it's almost like a grayish, shiny kind of color with a bunch of little black or red dots. That's very bad. That means they've had a lot of congestion over a lot of time. The tissues are too tight. They're not allowing fluids to move through the different layers. I'll explain that too later. Other one is over here. You get kind of like this one. It looks kind of purplish, but it's more of a yellowish, gray, purplish kind of tinge. And usually here we see blood and Qi deficiency. That means that blood and Qi, the energy, doesn't get to the area, so it's going to need more. Sometimes it's indicative of a very chronic issue. They may be on a lot of medications. They may be just super tight, or it could be something with the bone, the marrow, ligaments, nerves, something like that. So anyway, that's cupping as we do it here at Natural Body Works. We have a Groupon going on right now. You can check that out and try it if you like to. It ends up being about $20, I think, for you. It's kind of fun. Fun for me. I usually use heat with it. I like to move them around sometimes and get a little bit better result, a little bit more of that fluid up to the top. You should feel lighter and fresh afterwards. If you don't, you may feel somewhat fluish, kind of like you don't feel so good. Your energy's been sapped because we're trying to move energy where it hasn't been in a while. So there we go. That's cupping in a nutshell. There's one more kind of cupping I'll show you here. These are cups from Finland, rubberized suction cups. So they're very easy to use. You just stick them on like so, and you can either leave them on, but what I like to do is I'll use some different kind of medicated oils, and then we'll just move them back and forth, and that'll pull the tissue and pull all the fluids up in a line. Similar to gua sha, which is the scraping, but without scraping. This is just kind of like where we get a suction action. It's actually really beneficial. Very good if you have like the flu or something chronic, because you'll feel way better. You get done with things way quicker. And that's just because we've caused a change in the fluid movement through the different sections. What are the different sections, you ask, right? We have the blood system itself. That's the circulatory system. All the arteries, all the veins, all the arterioles, all the venules, all the capillaries. That's where the liquid blood is. That's plasma. And then we have the whole blood. That's the red bits and the white bits of blood, the red blood cells, white blood cells, and the platelets and all of that jazz. So we can pull from there with the cupping, and that's one of the red dots that we see. But there's more. As plasma leaves the blood system through the capillaries, it actually becomes interstitial, or fluid between the cells. So you have cells and fluid between them. That can become stagnant if it doesn't get moved. Then you have interstitial, which is intercellular, the fluid inside the cells. Then you go further deeper, you go deeper in there, you'll find what's called a lacteal or a lymph duct, or lymph capillary, and that's where the fluid becomes lymph. Now there's one more compartment after that. It's called transitional, and that's like in your eyeball or in your joints or stuff like that. And we can move those. So as you move fluids through different sections, they have to replenish. And they'll want to because of their osmolality and hydrostatic pressure, and then also the pressures of the tissues themselves changes a lot of the way things move. I know this is totally like Anatomy and Physiology 101, but hey, that's what I teach anyway. So you get those kind of fluid movements, and then you get replenishment, and then you get cleansing. It does stimulate the rest of the body to clean it up. You get some white blood cells moving through there. You get normal cleaning. It's just a normal cleaning action. There's no magic to it. It doesn't help you do anything other than heal better. Who can you not use it on? Someone who has a cut there. Someone who has a mole there, perhaps. You shouldn't use it on people who have a sunburn or other injuries, or they don't like it. You're not going to really like it anyway, but I mean, if you really don't want to do it, don't do it. Nothing that you have to do. Other people, we try not to do it on what's called the yin areas, which is the front, the soft underbelly. We try not to do it on neck. We don't do it on like the eye or something like that, although you see people use their lips and stuff. That's crazy. We try not to do it on the softer skin near vessels and stuff like that. Try to do it on the outside, the yang version, or the yang sections of the body, the outsides. That's where you get kind of the best benefit anyway. You can do it along the chest up through here if you have like congestion or maybe some bronchitis or something like that. It can help. So, and what it does is it doesn't cure it, it doesn't get rid of the bug, but it helps your body fight better. Anyway, this is Dr. Sean over at Natural Body Works talking about cupping. Thank you so much. Bye. That was shadow parking. See ya.